Guys, this is take two. You didn't see take one, but it was quite funny. I stumbled on my words from the get go. Anyway, I know it's been a month and you like to see me check in, so I had to come in and say hello to everybody, update you about how things have been going and where I've been the last month with my health and things like that. Tell you a little bit about Vicky, because Vicky's got a few things that are happening with her. So, without any further ado, or further ado, I bring Mr. Bronchi Superhero. I'm not anymore, far from that. I mean, when I first started the channel, I was in shape, young and handsome. I think I'm still handsome. I don't know about young and I don't know about in shape, but bronchiectasis is quite trickier these days, so it's not easy for me to keep a training regimen going. I can only exercise when I'm well, which isn't very often, and then it's interrupted by physical illness, infection, or some bug that's not an infection, some virus. Anyway, without chatting too much rubbish, I'll tell you where I've been. So, for anyone who don't know, when I first commenced home IVs, I was on my medication every 3 months for 2 weeks at a time, morning dose and nighttime dose. We then got a referral to a second chest hospital, so I'm very lucky. I don't know from the first, I might be the first bronchitis patient. Without having the studies, I don't know, but I'm under two specialists in Manchester. One that I've been under for a very long time, and the other one I've been maybe 2 years. So they got me on a medication called tobramycin, and it's an inhaled antibiotic. It can also be used as intravenous medication as well. So it's given twice a day, and the reason it's been given to me is because even with home IVs, as soon as I come off them, I went back to square one. Now, everybody who's watched my channel throughout the years knows that I hit a brick wall in regards to rescue pack oral antibiotics. So that's when my specialist stepped in and he got me a review at Wythenshawe Hospital, and they agreed that I would trial this medication, tobramycin. The first 3 months went well, 6 months. We did hit a stumbling patch, but we regained some optimism. That's what I'm looking for, because we switched to a mask instead of a mouthpiece. So we got better results with the mask, and I think that's because I have upper and lower respiratory problems. I have the nasal infections and the chest infections. So I think with the mouthpiece, even though you will inhale through the nose some of the mist, I don't think I was getting enough of the medication. So we continued with this, and we've seen some results. So me and my specialist, we sat down, we spoke, and we said, shall we try reducing the IVs annually to 3 times opposed to 4 times? So I tried to stick with this, guys. I wanted it to make my life that little bit better. Just having that little bit of freedom, I thought it would bring. So I stuck with this for a year. And what we found out, and what the IV nurses and what the specialists found out, is they were having to bring me on earlier to compensate it. So it shown, the evidence shown, it wasn't keeping me well enough. So what's happening now is the tobramycin is basically getting me to about month 2, and then I start flagging. It's almost like the tobramycin is masking the problem, so it's not a full-blown infection, but you still feel drained and fatigued, and you're waiting for your IVs to come. So I normally feel like that with a month whilst I'm waiting. Sorry about burping, but I've just had southern fried chicken and don't really like spices. I don't know, whilst we're talking the subject, I don't know if bronchitis patients suffer with like spicy foods, because I get central chest pain right there. So yeah, so we've gone back to 3 months. I've got the port in, as you know. I don't know if you see it. It's healed quite well, got the scar. So they're able to take bloods from there. It's absolutely great, because they were struggling to get bloods from me at one time. Well, I say at one time. at one time they were great, but all my veins were overused with all the hospital treatments, and they were giving up basically. So the midlines were becoming very difficult. So we got the porting. I'm only going over things because people are new to the channel. I know most of you know this. So anyway, I'm back to 3 monthly, and I had to stay on it like 2 weeks. That's just a standard procedure. And the other reason I got brought back to 3 months is now, it used to be the home IV team, but now it's not. It's like Northern Care Alliance. So the nurses aren't just prioritising IVs now. They're doing bandage changes. They're going here, they're going there and elsewhere. So what would happen is if I felt poorly, say in month 3, and I wasn't due by till the 4th month, there'd be a backlog. I'd have to wait 2 weeks, so then I would end up in hospital. And the whole reason of being on the home IVs is to try and keep you out of hospital, because that's where you pick bugs up from, and you get, if you go in with one bug, you could pick 2 up, you could pick 3 up, and then it could be very, very fatal. So anyway, back to what's gone on with me. Mine's a bit short and sweet, simple, like myself. Well, not simple, but like short and sweet. So anyway, I had the end of summer going into autumn flu, and it absolutely wiped me out. I knew it was a flu. I didn't think it was COVID. It was underlining COVID flu. I checked my COVID test 2 or 3 times, negative, and I was wiped out to the point that I thought, I always get to a point where I think, this might be it. I don't know if you used it, but I think this is it now. But then a part of you comes out, well, you survived all the other infections, you survived COVID, you'll probably get through it. But it did wipe me out. I had to stop everything. Everything stopped. I didn't go out for a while, so my anxiety levels peaked. Even now, I wouldn't say we're 4 weeks after the flu that I've gone out that much. And when I do, sometimes I know my anxiety is building up. It's even if I answer the door every now and then, it's like I need to try and get out more now. So that's where I've been. I had an ENT appointment not long ago. They put a camera up my nose, and they want to switch the I think it's called Metronidazole or something like that, which is a nasal spray, to a steroid liquid, and you put it in a Medi rinse. You put it in your nose with a salt treatment. Now basically, letters to the doctor takes a very long time. So when I come out of ENT, I only come out with enough for about 2 weeks. I phoned the GP. The GP said the letter's not here yet, so I've not got my steroids for my nose. So we're just waiting on that. Now I'll tell you about Vicky, because a lot of people do ask about Vicky and how she's getting on. Well, Vicky has had countless problems with her port, which is this port in the chest, for about 2 years now. When the nurses come to needle it, they struggle, and sometimes it takes 2 attempts, 3 attempts, and she's in a lot of pain. This is if anyone's had a port needle before, it's quite sore. You even have to put a cream around it first before they come. And then it'd go into day 2, someone else would come out, and they couldn't get it, so it was delaying her medication, which isn't good. When your medication's due, you don't want to delay it. So then only the more experienced people were coming out, and they were getting it, but not always on the first attempt. She then spoke to her specialist, who said, I think it's about time that we remove this and insert a new portacath. Now, Vicky must be braver than I am, because they want to do 2 procedures on the same day. Take it out, put her in recovery without sewing it up properly, just so it doesn't obviously bleed. See how she's in recovery for about 2 hours, and then fit the port in. And I'm thinking, if I have any problems with my port, it's getting taken out and there isn't another one going in. Now, I know I say that based on what I'm saying now, but when the facts come to the table, then things are thrown at me. I probably say, go on, stick one in. But they're very, very painful within the first couple of days of having them. But if you have an infection, like I did, skin infection or whatever, that pain is bad. Trust me, and it lasted me nearly 2 months. I had to be on antibiotics 2 times to clear that up. So I think I've touched up on everything. She's having a new port fitted in. She's not too well at the moment. She's recently had a hospital visit because she had chest pain a lot when she was coughing, and she experienced collarbone pain. And I was telling Vicky that when I was a kid, my chest pain when I breathed in deep was from the collarbone. And as I've got older, I've not experienced that pain with chest infections. This is the first time Vicky's experienced it. So anyway, they checked her over. She stayed, I think, a day in hospital because they wanted to rule out it wasn't a blood clot because it was near the port, and everything was fine. There was no collapsed lung. Vicky has had collapsed lung in the past, and she suspected it. But anyway, they said it may be a start of an infection or a virus that's trying to turn into an infection, bacteria. She still isn't great now. She coughs, is still in pain a bit, bless her. And they had a review with the doctor today. She explained that she's still in pain when she breathes, so just to keep an eye on it. And if it gets worse, probably just take some rescue packs or even possibly start her on IVs. And I think that's about it. I don't think I've missed anything else out, and if I do, you can always catch me on the next one, probably next month.